With state-line hospital beds at capacity, local medical facilities struggle to meet the demand. Right now, a visit to the emergency room could mean a much longer wait than you're used to. Rachel Perry's been looking into this issue. Rachel, how long are some patients sitting around?
Eric, I'm told it can be anywhere from 30 minutes to nearly 10 hours. The two women I spoke with said their experience was about 8 hours each, one saying she lost nearly 3 units of blood during that time.
He was having a lot of trouble breathing, and it was with every breath he was gasping.
Jennifer Knight is thankful her dad is alive today. After having a pulmonary embolism, Knight tells me he ended up waiting 8 hours at the OSF emergency room.
He basically just watched as people came in and came out, and I know that there were people that just got frustrated and ended up leaving.
Her dad would spend the next 9 days in the hospital.
They ended up doing a CT scan, I think at like hour 6 that he was there. And then at hour 8, a doctor came out and got him out of the emergency room, waiting room, and took him back because, he had a pulmonary embolism. It was a fairly large clot, and those can be deadly if they're not treated right away.
Long wait times are nothing new right now. Since the start of the pandemic, hospital beds and nursing staff have faced shortages, causing some people to wait hours to be seen.
I walked in, said, I think I'm miscarrying. I'm 8 or 9 weeks along. And I was parked out in the emergency room, waiting room, until a room was available.
Nearly 7 hours later, Courtney Edgington was finally seen at Mercy Health Riverside. She says at that point she had lost a lot of blood.
While I was in there getting a DNC, they had to put 3, almost 4 units of blood transfused into me. So I very closely died that day.
Knight says in her experience at local hospitals, the staff just can't meet the demand right now.
There are a lot of empty beds, but there's just not enough nurses to accommodate all those patients.
There's been a nursing shortage for years, even before COVID, but the pandemic has only made it worse. I did reach out to both OSF and Mercy Health about the long wait times. Neither have responded yet tonight. Eric?
Thanks, Rachel.